So again, these are things that I've been combining on my own clinically. And this is an iNAP lecture, so we're talking about improving the overall response to iNAP. So there's a couple things I've been doing. The first thing is obviously if there's any nasal dyspnea or even a positive caudal test where the nasal valve collapses, and then you support the lateral tissues to find a patient's subjective improvement, like, oh, this feels better. We want to improve that sort of restriction at the nose too, because nasal restriction can affect snore management down the line in the velopharynx, oropharynx, and even hypopharynx. So we want to positively improve the Bernoulli effect, as well as, I'm not going to try the other physicist's name,
effect.
who talks about the lumen collapsing, and as the lumen gets smaller, you have the power to 4 of how much more collapsible that airway is. So the nose needs to be supported to have good snore management down the line. So I would be very proactive on nasal hygiene. And it turns out that if the mouth is dry, it's unhealthy tissue. That same thing is important for nasal tissue. So hydrating that with some easy to use over-the-counter therapies like Clear, or some patients will call it X-Clear, XLEAR is a nasal saline with xylitol, which breaks down biofilms and hydrates the nasal membrane, doing that several times a day. If you've identified any atopic issues, so allergies, obviously oral antihistamines, nasal corticosteroids, or nasal antihistamines. We also use a biomimetic nasal disinfectant called HOCl, which is a very, very low concentration of 50 parts per million that your body makes already when it sees inflammation at the white blood cell and the macrophages. Basically, that will also trigger an anti-inflammation response. So we're very, very proactive in nasal hygiene is what we're calling it.
Let me share that screen of, you have this view here that might be helping when you are.
Yeah, thank you for sharing that. So this is an actual patient of ours where I've partnered up with a local dental sleep medicine provider, and he has access to a high quality cone beam CAT scan or a low radiation digitally enhanced CBCT. So you can see on the left, the nasal turbinates are pretty swollen, the inferior turbinates. They're swollen, there's a slight nasal deviation, but not something that would change your treatment plan. It's really, the turbinates need to be healthier. And so after 2 weeks of consistent usage of nasal hygiene, basically hydrating the tissues regularly, washing any particulates or any irritants off the nose, and the more again, moisturize the tissues, the healthier they are. So nasal tissues, if they're dry, they're inflamed, just like oral tissues. So this was after 2 weeks of implementing just nasal hygiene. On the right side, that same patient has really, really improved size of the nasal turbinates, the soft tissue of the nasal turbinates. And then you can automatically see in the oropharynx, the patient's tongue posture dramatically improved. On the left, there's a big space in the roof of the mouth where the tongue was actively being suppressed downward because the patient is mouth breather. Then over those 2 weeks, the patient's naturally becoming more of a appropriate tongue posture patient. So that tongue's sitting right in the roof of the mouth where it should be. Now, this patient also has a narrow palate. So if you have a narrow palate, that soft tissue, hard tissue match is not necessarily a natural sort of fit. So now that the nose is working better, they can actively work at becoming closer to a typical tongue posture patient. So this is why we're really proactive at improving nasal function. Of course, if the CBCT showed some significant other anatomical variations, then that triggers us very early on in our treatment plan to reach out to one of our partner ear, nose, throat doctors and then attempt to implement some other intervention that could be initiated by the ENT in our interdisciplinary group here. And that's really important. We want to be really working on interdisciplinary, that's a long word, disciplinary team work, so we have the best outcomes for our patients. But this is a really powerful before and after. And again, this was only 2 weeks of usage of nasal hygiene.
Thank you. And obviously, nose breathing is a key condition to be successful with iNAP as well. So that's why it's important.
Books like Breathe by James Nestor have really popularized the importance of nasal breathing. And if we're not nasal breathing during the day, that can also potentially affect our nighttime breathing habitus, right? So if we're gulping down large volumes of air through the mouth during the day, then we're resetting our whole loop gain. We are used to having essentially hypocapnia. We're blowing off all of our carbon dioxide. And we know that in the alveolus as well as the blood, we need a certain amount of carbon dioxide pressure of gases to keep the alveolus open, to exchange the oxygen over the red blood cell, the alveolus membrane, so that oxyhemoglobin curve needs to be enhanced by improving nasal function and avoiding mouth breathing.